Most men never say this out loud. They notice it, they think about it, and then they file it away in that private category of things they've decided to stop expecting. The strong, reliable morning erection that used to be simply part of waking up, present without effort, without thought, as natural as opening your eyes. And then one day it's weaker, then less frequent, then absent more mornings than not. And the man lies there in the quiet of the early morning and wonders, without quite wanting to ask the question directly, what that absence means. I'm Dr. Fernanda Oliveira, board certified urologist, and I want to answer that question today. Directly, honestly, and in a way that I hope replaces whatever quiet worry you've been carrying with something far more useful: understanding, and a simple, practical habit you can begin tonight. My dear friend, if morning erections have been changing for you, becoming weaker, less consistent, or disappearing from your mornings altogether, please know that you are in very good company. I see this every single day in my practice, and the men describing it to me are not men who have neglected their health or made poor choices. They are often careful, conscientious men who simply haven't been told what these changes actually mean and what can genuinely be done about them. There is absolutely no reason to feel embarrassed. This is biology, specific, understandable biology, and biology, unlike shame, can be worked with. So let me start with the meaning, because I think most men have been told either nothing about this or something incomplete. And the incomplete version tends to generate more anxiety than it resolves. Morning erections, the medical term is nocturnal penile tumescence, are not primarily about sexual desire. This is the most important thing I can tell you about them because it completely reframes what their presence or absence communicates. They are an automatic physiological process. During REM sleep, which cycles through the night multiple times in healthy sleep architecture, the body increases blood flow to erectile tissue as part of its own internal maintenance routine. This is the body testing and maintaining the vascular and neurological pathways that serve that tissue. It is automatic. It is unconscious. It is, in a very real sense, your body performing its own daily system check on the health of your circulatory and nervous system in that region. When morning erections are strong and regular, they tell you that circulation is working well, that the nerve signals governing sexual response are intact and responsive, and that the deep sleep cycles providing the physiological window for this process are occurring adequately. When they weaken or become infrequent, the body is communicating, in the clearest language available to it, that one or more of those systems is not functioning as efficiently as it should. It is not a statement about your masculinity. It is not a verdict on your intimate future. It is information. And information is something you can act on. I had a patient, a man in his early 60s, who came to me convinced that his testosterone levels must have collapsed. He had done some reading online and was prepared to discuss replacement therapy. When his blood work came back, his testosterone was lower than it had been in his 40s, as it naturally is, but not dramatically deficient by clinical standards. What was clearly present when we looked at his full picture was a pattern of poor sleep quality and significantly reduced pelvic circulation, driven by a sedentary daily routine and chronic low-grade stress. His body was capable of producing adequate testosterone, but the systems that translate that hormonal capacity into the physical response he was hoping to restore, circulation, nervous system regulation, sleep architecture, were all operating below their potential. We addressed those things, not his testosterone levels directly, the systems surrounding and supporting them. And the improvement in his mornings over the following month was, by his own description, significant and genuinely surprising to him. That story matters because it illustrates the central point I want you to carry through this entire conversation. Morning erections are not a single variable problem. They are the output of three interconnected systems working together: circulation, the nervous system, and sleep quality. When all three are functioning well, the output is reliable and strong. When any one of them is compromised, the output reflects that compromise. And when two or three of them are simultaneously operating below their potential, which is more common than not in men over 50 who haven't specifically addressed these systems, the cumulative effect on morning erection quality is significant. Think of it like a car engine. The engine may have good fuel, adequate testosterone, genuine desire, no serious underlying pathology. But if the oil is low, the coolant is running warm, and the spark timing is slightly off, the engine doesn't perform the way it should. Not because anything is catastrophically broken, because the supporting systems aren't giving it the conditions it needs to run at its best. Restore those conditions and the performance returns. Not magically, not instantly, but reliably and progressively over time. Let me take each of these three systems and explain what happens to them after 50, because this is where the solution, including the specific bedtime habit I'm going to share with you today, begins to make complete biological sense. Circulation first, because it is the most direct driver of morning erection quality and the one most amenable to targeted intervention. As men age, nitric oxide production by the endothelial cells lining the blood vessels gradually declines. Nitric oxide is the signal that tells smooth muscle in the vessel walls to relax and allow the vessel to dilate. Without adequate nitric oxide, vessels maintain a more constricted resting tone. Blood flow to the pelvic region, and specifically to the erectile tissue that needs robust circulation for the overnight maintenance process, becomes less efficient. The system still functions, but with reduced pressure, reduced responsiveness, and reduced completeness. Compound this with the effects of prolonged sitting, which compresses the pelvic blood vessels mechanically for hours at a time, and with the vascular stiffening that accumulates from years of suboptimal diet, chronic stress, and inadequate movement, and you have a circulation picture that is working against morning erection quality from multiple directions simultaneously. Not any one of these factors alone being catastrophic, all of them together creating a cumulative circulatory deficit that the body reflects in the one morning signal that tracks vascular health most honestly. The nervous system piece is equally important and less often discussed. Morning erections occur during REM sleep because REM sleep is a period of heightened parasympathetic nervous system activity, that rest and restore mode that allows the body to carry out maintenance processes that can't happen during the high alert state of waking life. For the parasympathetic system to be sufficiently active during sleep, it needs to have been adequately downregulated from daytime stress and sympathetic arousal before sleep begins. Men who carry high cortisol and chronic stress tension into bed, who transition from the demands of the day directly to the pillow without any deliberate nervous system wind down, often have fragmented, lighter, more sympathetically active sleep. And in that state, the parasympathetic window for nocturnal erection is compressed or incomplete. This is why the bedtime habit I'm going to share today works on two levels simultaneously. The gentle massage technique I'm going to describe directly stimulates local circulation in the pelvic region, but the act of performing it, the intentional, quiet, attentive minutes before bed, also serves as a parasympathetic activation practice. It pulls the nervous system toward the calm, restored state that sleep architecture requires for robust REM cycles. It is physiological on both fronts. And that dual mechanism is precisely why men who practice it consistently report improvements not just in morning erection quality over time, but in the quality of their sleep itself, which amplifies everything else. Sleep quality is the third system, and I want to emphasize something specific about its relationship to morning erections that most men don't know. REM sleep, during which the nocturnal maintenance process occurs, is not uniformly distributed across the night. It is concentrated in the later sleep cycles, the ones that occur in the final 2 to 3 hours before natural waking. This means that men who wake early, whose sleep is interrupted in the second half of the night, or whose total sleep is shortened below the 7 to 8 hour threshold, are disproportionately losing the REM-rich sleep that the body most needs for this particular function. Protecting the full duration of sleep, and specifically the later hours of it, is one of the most direct things a man can do to support the frequency and quality of morning erections. It is not a peripheral concern. It is central. Now I want to introduce the specific technique today in its proper context before we go into the full detail in the second half of this conversation. The lower abdomen, just above the pubic bone, is an area that sits directly over one of the primary pathways of blood supply and nerve communication to the pelvic region and erectile tissue. Gentle circular massage of this area before bed, 1 minute, performed consistently as part of a deliberate pre-sleep routine, does something that most men have never thought to do intentionally. It encourages temporary dilation of the local blood vessels in this gateway region. It releases tension that accumulates in the lower abdominal and pelvic muscles throughout the day. And it provides a direct parasympathetic signal to the nervous system through the act of slow, attentive, self-directed touch. A signal that says, in the body's own language, that it is safe to relax, that the day's demands are finished, and that the conditions for deep, restorative sleep are being prepared. This is not a complex intervention. It does not require training or equipment or any significant investment of time. It requires 1 minute of genuine attention directed to the right place at the right moment in the evening with the right intention behind it. And for men who have been lying in bed wondering about those absent or weakened mornings, it is one of the most accessible and personally empowering steps available. But before I walk you through the exact technique, the precise location, and the step-by-step method, I also need to tell you about 3 mistakes that men commonly make when they first try this that prevent it from producing any benefit at all. One of them is so counterintuitive that it catches almost everyone off guard. That is exactly where we're headed next. Let's finish this properly because the technique itself is simple, but simple done correctly is entirely different from simple done carelessly. And the difference determines whether this becomes a habit that genuinely changes your mornings or one that you try for a few nights and quietly abandon. The mistakes first, because they frame everything that follows. The first mistake is applying too much pressure. This is the most common error and the one with the most immediate negative consequence. The lower abdomen is not a muscle knot to be worked out. It is not a point that responds to force. The tissue in this area, the skin, the superficial fascia, the underlying structures, responds to gentle, sustained pressure, not aggressive manipulation. When men press too hard, the body's response is protective tension. The muscles beneath the pressure contract rather than release. Local blood vessels constrict rather than dilate. The nervous system registers the pressure as a mild threat rather than a relaxation signal, and the entire intended effect, parasympathetic activation, circulatory support, pelvic floor release, is reversed by the very force being applied. The correction is to use significantly less pressure than feels intuitive. If you have coconut oil on your fingertips and you are performing slow circular movements, the contact should feel like a warm, attentive presence on the skin, not a therapeutic dig into the tissue beneath. If you press and feel yourself bracing or holding your breath, you are pressing too hard. The breath test is actually a useful guide here. If your breathing remains slow and natural during the massage, your pressure is appropriate. If it causes you to subtly tighten or hold, reduce the pressure until the breathing stays easy. The second mistake is inconsistency. Men try this for 2 or 3 nights, notice no dramatic change, and stop. And I understand that impulse completely. We have all been conditioned by a world that promises rapid results and a technique that asks for 2 to 3 weeks of consistent practice before its effects become noticeable runs against that conditioning. But the changes this technique supports are adaptive changes. The nervous system gradually learns that this sequence, this minute of gentle attention before bed, is a reliable signal that rest is coming. The pelvic circulation gradually improves with repeated stimulation. The sleep architecture gradually deepens as the parasympathetic activation becomes more reliable. None of these are overnight shifts. All of them are real, progressive, and cumulative. One of my patients, a man in his late 50s, came back after 2 weeks of inconsistent practice, some nights doing it, other nights skipping, and reported no meaningful change. We talked through his routine, and I asked him to commit to every single night for the following 3 weeks without exception. He came back after that period, and the difference in his report was substantial. Deeper sleep within the first week of consistency, improved morning response beginning in week 2. By week 3, something he described as a return of a reliability he had stopped expecting. The technique was identical. The consistency was the variable that changed everything. The third mistake is performing the technique while distracted. Phone in the other hand, television on, mind running through the next day's concerns. The neurological benefit of this practice depends on genuine present moment attention. The parasympathetic activation that it is designed to produce requires the nervous system to actually be receiving the signal, which means the mind needs to be participating rather than elsewhere. 1 minute of genuine, quiet, attentive presence produces a fundamentally different physiological response than 1 minute of the same physical motion performed on autopilot while the brain is engaged with a screen or a mental to-do list. This is not mysticism, it is basic neuroscience. The nervous system responds to the totality of the moment, not just the physical input in isolation. Now let me walk you through the technique properly so that you have everything you need to begin tonight. Wash your hands before you begin. If you have coconut oil available, warm a small amount between your fingertips, just enough to allow smooth contact without friction, not a large quantity. Lie down on your back in a comfortable position. Take 3 slow breaths before you begin. In through the nose for 4 counts, out through the mouth for 6. These 3 breaths are not a formality. They initiate the parasympathetic shift that makes everything that follows more effective. By the third exhale, your nervous system should already be moving in the right direction. Place the pads of 2 or 3 fingers of one hand on the lower abdomen, just above the pubic bone, in the soft tissue midline, where the lower belly begins to curve toward the pelvis. This is the gateway area we discussed earlier, sitting directly over the primary vascular and nerve pathways supplying the pelvic region and erectile tissue. Begin slow, circular movements, gentle, deliberate, unhurried. The circles can be small, roughly the size of a coin, and you can vary their position slightly across the area during the minute without needing to be precise about any particular point. The goal is sustained, gentle stimulation of the region, not the activation of a specific acupressure point. Continue for 60 to 90 seconds. Keep breathing slowly throughout. If you notice the pelvic floor relaxing, that subtle internal release sensation that we've discussed in the context of prostate health, allow it, welcome it. It is a sign that the technique is working as intended, that the nervous system is interpreting the signal correctly and responding with the relaxation response you are trying to cultivate. When the minute is finished, remove your hands, take 2 more slow breaths, and allow yourself to remain still for a moment before moving into your final pre-sleep preparations. The few minutes of quiet that follow the massage are part of the practice. They give the nervous system time to consolidate the relaxation signal rather than immediately re-engaging with stimulating activity. Perform this 3 to 4 nights per week at minimum, every night if you find it becomes a comfortable and welcome part of your routine. As I said earlier, consistency is the determining variable, and more consistent practice within the bounds of what you will actually sustain long-term is always preferable to intense, short-term effort followed by abandonment. Now I want to address the surrounding habits because the technique sits within a system, and that system determines how much the technique can contribute. A 1-minute massage before bed cannot compensate for 3 hours of screen exposure, a large late dinner, poor sleep hygiene, and chronic unmanaged stress. But when the surrounding habits are supportive, the technique amplifies their combined effect, and the results are meaningfully greater than any individual component would produce alone. The evening routine I recommend building around this practice looks like this. Finish dinner at least 2 hours before sleep, light, not heavy, so that digestion is mostly settled by the time you lie down. Step away from screens at least 30 minutes before bed and 45 to 60 minutes if you can manage it. The blue light suppression of melatonin and the cognitive stimulation of screens both work against the parasympathetic state you are trying to enter, and removing them from the pre-sleep window is one of the highest leverage changes available for sleep quality. About 45 minutes before bed, prepare a simple warm drink. Warm water, a squeeze of lemon, a pinch of Ceylon cinnamon, and optionally a teaspoon of raw honey, small volume. Sip it slowly in a quiet space without screens. The cinnamon supports overnight blood sugar stability, which prevents the early morning cortisol surge that disrupts the final REM cycles. The lemon provides mild antioxidant support. The warmth and the ritual itself signal the nervous system toward rest. If magnesium glycinate is appropriate for your situation, 200 to 400 milligrams alongside this drink, it adds direct, smooth muscle relaxation and sleep architecture support that complements everything else. Please discuss supplementation with your doctor if you have any underlying health conditions or take medications. Then your 3 slow breaths, your minute of gentle massage, your 2 final breaths, and sleep at a consistent time for the full 7 to 8 hours that the later REM cycles require. Consistent bedtime is not optional here if morning erection quality is the goal. As I explained earlier, the nocturnal maintenance process that morning erections reflect is concentrated in the final sleep cycles. Cutting sleep short, even by 45 minutes, disproportionately removes the most REM-rich portion of the night. Let me tell you what the realistic timeline looks like when all of this is in place, because I want you to have accurate expectations that keep you committed through the weeks when the results are still developing. In the first week, most men notice the sleep improvement before anything else. The evenings feel calmer, the transition into sleep comes more easily. Some men describe waking in the morning with a clearer sense of having actually rested rather than simply having had time pass. This is the parasympathetic activation doing its work. The nervous system is learning the pre-sleep sequence and beginning to respond to it more efficiently each night. In the second and third weeks, the sleep quality improvement deepens. REM cycles become more complete. And then, somewhere in this window, men begin noticing the first signs of change in the mornings. Not every morning, not dramatically at first, but the response that had been absent begins to return occasionally. The strength of it when it does occur begins to improve. The frequency gradually increases towards something more reliable. By week 4 and beyond, for men who have been consistent, the pattern becomes recognizable and encouraging. Mornings feel different. The body is communicating what it communicates when the vascular and neurological systems underlying this function are being adequately supported. That the maintenance is happening, that the circulation is reaching where it needs to go, that the overnight system check is producing a positive result. One of my patients, a man in his early 60s who had not had a reliable morning erection in over a year, came back after 5 weeks of following this complete routine. He said something I think about often when I'm preparing a video like this one. He said he felt like his body had come back online. Not like a younger man's body, like his own body, functioning the way it was designed to, without force or medication or anything that felt foreign. That phrase, come back online, captures something important. This is not about becoming something you weren't. It is about restoring what your body is genuinely capable of when the conditions support it. As always, please remember that this is educational information offered with genuine clinical care, and it is not a substitute for medical advice. If you are experiencing significant or sudden changes in erectile function, persistent absence of morning erections, or any concerning symptoms, please see a qualified urologist. Some causes of erectile changes require proper clinical investigation, and this technique is appropriate for the common pattern of age-related circulatory and sleep-related decline, not for acute or serious underlying conditions. If you are going to begin tonight to take those 3 breaths, place your hands, and give your body 1 quiet minute of deliberate support before sleep, go to the comments right now and type the words, "I'm trying this tonight." Say it. Name it. The commitment matters. And if this conversation gave you something genuinely useful today, a clearer understanding of what your mornings are telling you and what you can do about it, please subscribe to this channel. Every week, I bring you honest, practical, clinically grounded guidance to help men over 50 support their health in simple and sustainable ways. With small, consistent habits, my friend, your body can come back online. The capacity is there. It simply needs the right conditions to express itself. I'll see you in the next one. Take good care of yourself.